So far so good, but to shamelessly borrow from this morning, so what? We've got a good reduction, we can see that. But it's still a long way from the sustained success that Dan was talking about this morning, where we need to demonstrate that we're continuously problem solving on the ward. And this is, of course, a pilot. It's something that we need to spread out to other wards in the hospital and other hospitals in the trust. And we're going to do that through Catchball, which we've already seen this morning. Catchball is a game between children that improves, hopefully, their performance. And it needs to be challenging, like that, but it needs to be realistic. But Catchball, apart from being a good way to physically abuse your boss, if you swap the ball for an idea or an objective, it becomes a good continuous improvement tool. Okay, so we have our strategy, which David talked about. That's moved down the chain from senior executive management to middle management, and we've taken that through a Bayer, and we've come up with a site plan, and that's gone down to the ward, where we've had a pilot. So the strategy of achieving a lower length of stay through good clinical improvement has gone all the way down to the ward through a here's a plan to safely treat and discharge this patient, and we expect that plan to be delivered on time and in full where we can. Going back up the chain, however, so this is the strategy has come down this side. Going back up, we have questions, we have plans, and we have issues. And some of those issues that Jane shared with us on her Pareto chart have remained unsolved. So we need our system, our Catchball system, to be able to do that. We're fairly happy then with Catchball. We've already discussed quite a lot, actually, that Catchball is pulling everyone in the same direction. It's aligning our strategies and our on-ground floor performance. It's worked for us. We've had better focus in squeezing out the delays in decision-making. Zoe talked about the successes we had in Bayer. We've resolved a lot of issues that happened across the hospital in things like transport. But we're not doing quite so well getting the issues, some of the issues, closed back up. We are, in fact, batching and queuing them by our Bayer process, because we're taking those issues from the ward, we're collating them, we're meeting in a meeting room once a week with a big load of batch issues that might have some semblance, and then we're trying to resolve them and hoping that the group of people that are there are able and understand the issues well enough to be able to do that. We also know that the power is in the discussion and not in the meeting room, so we need to change our Catchball process a little bit, and we did that through purpose, process, and people. Purpose is very clear, it hasn't changed, in fact. It's to reduce length of stay through safe practice. We've already talked about that quite a lot. So we've rolled this down, we've pushed this down. There was a bit of resistance and some concerns on the wall that this is another NHS performance management tool, to which we sort of responded, well, yes, it is, but it's performance management that goes both ways, because what's happening here, you have your strategy coming down with the KPIs that are attached to it, so you'll reduce length of stay to 4.5 days average or whatever. But there's also the loop back up, which is we now, as managers, have the responsibility to be there and introduce quality at the source, make sure that we're resolving the issues where they're happening. And if we're not doing that, that's our performance that's very poor. So it's not just performance that's pushed down through a KPI, it's performance management that's pushed back up. Looking at, are you doing, as managers, giving the support and making decisions where we need it. The process is to get rid of the batch and queuing. So to do that, we're going to have to go as managers to the workplace. We have 3 levels of management in our Bayer process. And to close this issues loop, we've all got to be involved in going to the workplace to resolve the issues or escalate them to the next level of management if we need to. So we talked about finding themes, which remains important. So it's important not to just go to the ward and resolve issues there, but as a manager, make sure that you're collecting those themes and you continue to collect those themes, take them back and make sure that we we do push those resolutions and theme those findings across the trust. A good example that is on Jane's Perito here is one of doctor reviews. That wasn't something that just happened on Jane's ward, it's something that happened across the trust. So from this process of collecting all these themes that happen on each individual ward, we've been able to put in a trust-wide, in fact, escalation policy that if a consultant doesn't turn up on the ward at their expected time, and Jane has staffed her ward full of nurses ready to escort those consultants around, we've got a very quick process to resolve that issue because we see it happening an awful lot in terms of volume and an awful lot across the entire trust in most of the wards. For the people, all three levels of people have to understand, really, and to be competent in reviewing the plan for every patient process. So what we've done is job instructed them. So we haven't just sat them in a training room and said, this is what plan for every patient is all about. We've used job instruction where they have to actually see the plan for every patient in action. They've got to do it, they've got to hold the pen, they've got to understand, fill in the board, and then they've got to go through a series of follow-up in order to assure that they are competent and that the process is done safely. It's important because everyone has to be able to contribute, everyone's got to be competent in doing this in order to make a decision, to be able to evaluate what's going on and really get behind the issues as they come up. The decision at the end of it has got to be good and got to be understandable. And we also record the catchball process so that we can monitor progress and understand, go through the usual PDCA cycle. What have we learned? We've learned that catchball is a management tool. It is a tool, it's not another initiative, and that's very important in the NHS to make sure that that is understood. We designed and use it to sustain improvements, and that's the tool, that's the function of the tool, and that's how we've rolled it out. We always go to the place of work to perform catchball. That's where the issues happen, that's where all of the workforce is, of course. So taking issues out of there and taking to a meeting room where just a few representatives are once a week just didn't work for us. Why would it? Managers must make themes of the issues, so we're still making sure that any themes that happen across all of the wards or all of the sites are taken care of and prevented, not just resolved at one ward level. And we also learned, of course, that everyone must be involved, must be competent in the system. All three levels of management must be rotated to make sure they go there frequently enough not to add delay into the issue resolution, and that they are competent enough to make that decision, evaluate what's being shown to them.